Okay, this is my sterile dressing change video for my Miss Lab as a runner. I'm going to use this baby doll because I do not have a mannequin at home. But first, what I would do is review my order and plan of care and gather all my necessary supplies. And I have my sterile gloves, my ABD pad, my gauze sponges, my cotton tip applicators, my sterile gauze strips. I'm going to use this water and pretend like it's saline. And then I have my tape if needed. So I will gather all that. Then I'm going to identify my patient. I'm going to ask them their name, and then I'm going to check their wristband and check it against the patient file. I'm going to explain the procedure to the patient, saying that we're going to pretend like this is an abdominal wound with clean edges. And then I'm going to remove their dressing and check their wound and replace their dressing. And I would see if they need any pain medication before they start and assess their pain level. And then I'm going to perform my hand hygiene, and I'm going to wash my hands and provide for privacy. I'm going to place a waste receptacle or trash can in an appropriate location next to the patient, probably in the floor beside the bed where the patient is laying. Apply personal protective equipment if needed. And I'm going to position my patient so that any fluid or drainage will drain away from the wound. So if it was on a leg, we would elevate the head so that the leg is propped up and everything would run away. I would apply clean gloves, just regular gloves, and remove my old dressing that's on there. If the dressing and tape was to stick or anything, I would use my saline and just kind of moisten it with an extra gauze to remove it so as not to pull the wound. I'm going to note any odor, drainage, the state of the wound, make sure it's not red and infected and swollen. We don't have any descendants coming from it. I'm going to remove my clean gloves. I'm going to perform my hand hygiene again and wash my hands. Now, then I would take my gloves first, and we're going to open everything pointing down and away from me so that it stays sterile. And I would have cleaned off the bedside table to make my sterile field. And when I open this, I'm only going to touch the outside of the package. Sorry, I didn't allow for enough room. And only, again, touching the outside so that everything would remain sterile. And then I'm going to open my gauze, my sterile gauzes, again, away from me, only touching the outside of it. And I'm going to place them in my sterile field. And I'm going to leave my sterile tray open so that I can wet my gauze pads. I'm going to open my ABD pad. Again, outside of the package, away from me, and place on my sterile field. My cotton tip applicator, away from me, so that it falls right on my sterile field and remains sterile. And my gauze that I'm going to use afterwards, I won't open it right now because that's the one that's going to go on top. Now I'm going to pick up my gloves, outside only, and I'm going to wiggle my hand in there, making sure that I do not touch any part of the cuff. I've got my fingers on. So I've got that one about halfway on. I have to use my other glove to fix it. Again, I'm going to pick it up, outside only, never touch, or inside only, I'm sorry, never touching the outside of the glove except with my other sterile gloved hand so that everything remains sterile. Now, I'm going to put my saline in, and we're going to put some of my dressings I would put in here and then pour my saline in it so that I have my wet dressings as needed. Now I'm going to pick up one of my wet dressings, and we're going to fold it corners in We're going to clean our dressing. We're going to start from top to bottom, one swipe, and then I would throw this away and get another one. 2, throw this away and get another one. 3, throw this away and get another one. 4, away. 5, away. So that's would be in the trash. Then I'm going to take my cotton tip applicator and I'm going to measure the wound. I'm sorry. I would pour the saline in there before I put my gloves on because that's not sterile. Now, we would dry this again, corner to corner, so it makes a little bow off of my sterile field. And again, this is all sterile. We're going to dry the same way. 1, throw away, get another one. 2, throw away, get another one. 3, throw away, get another one. 4 and 5, and another one for every swipe that we use. Now we're going to measure our wound if it was tunneling, and I would use the cotton tip and I would put it into my gauze a little bit, and we're just going to stick it in there. We're not going to probe, just very gently, and we would measure each surrounding edge, and you could hold it up against the ruler on your packaging without touching it so you could eyeball the distance. Now I'm going to wet my gauze packing and I'm going to squeeze the excess fluid, and then I'm going to gently apply this, and I would take it and I would use my cotton tip applicator to work it down in there gently. We don't want to put, I didn't make my wound big enough. We don't want to put it all the way down, even with the edges of the wound, because we don't want the edges of the wound to get wet, leaving a little bit sticking out right here just so that you can get there. Now, we would apply our dry sterile gauze pads over the wet gauze. So we're going to apply a sterile one over, and then we would apply our ABD pad over the gauze. And then we're going to remove and discard our gloves, and then I would take my tape and I would go around the edges of the wound, or I'm sorry, the edges of the ABD pad. I just made that not sterile, but and then I'm going to note the date, time, and initial on the outside of the dressing, either on the tape or the outside of the pad, preferably on the tape. Then I would clean up all of my mess and scoop it all up in my sterile field and discard it. I'm going to make sure my patient is in a safe position, rails up if needed, bed in lowest position, call light within reach, perform my hand hygiene, and then document my procedure.